Our next speaker today will be Dr. Shaun Brown, who's from WashU in St. Louis. Shaun will be presenting collagen type 1:3 ratio in the supporting ligaments of the gastroesophageal junction in patients with paraesophageal hernia.
Good afternoon, and thank you for this opportunity to present our research. This research was funded by a 2008 SAGES grant. The title of our research is Collagen type 1:3 ratio of patients of the gastroesophageal junction in patients with hiatal hernias. These are our disclosures. Hiatal hernia is a herniation of abdominal organs through the diaphragm at the esophageal hiatus. This condition is commonly encountered in surgical practice with a prevalence in normal subjects of 15 to 60%. There are 4 types of hiatal hernias defined by the content of the hernia sac and the location of the GE junction in relation to the diaphragm. Type 1 hiatal hernia is the most common, also known as a sliding hernia, where the GE junction is located above the diaphragm. Most of these patients will present with gastroesophageal reflux disease-related symptoms. Type 2 paraesophageal hernias are unique in that the GE junction is in the normal anatomic position, but the fundus of the stomach herniates into the chest through a defect in the frontoesophageal membrane. Type 3 hernias are a combination of type 1 and type 2, and type 4 consists of a large defect which will allow other abdominal organs to herniate into the chest. A fundamental question is whether hernia formation is a sequelae of excessive mechanical stress or the result of an ongoing biologic disorder of collagen deficiency or integrity. Recent investigations have shifted research to explore the biologic processes involved, specifically looking at collagen metabolism. Type 1 and 3 collagen account for 95% of the collagen present in the dermis. Type 1 is mature, stable, and strong, while type 3 is present during early wound healing and is immature and weak. Changes in collagen 1 and 3 composition are associated with inguinal hernia formation. The quality of collagen has been characterized by the ratio of type 1 to 3 collagen. A decrease in this ratio would indicate that the strong type 1 collagen was diminished or the weaker type 3 collagen was more prevalent. In either case, the integrity of the structure would be compromised. The normal ratio of type 1 to 3 found within the skin is 4:1. There is an established relationship between inguinal hernia formation and a decreased ratio. There's never been an investigation looking at the collagen ratio in hiatal hernia formation. Our group has previously explored the biologic environment in relation to hiatal hernia formation through the evaluation of elastin content within the 3 supporting ligaments and found that hiatal hernias are associated with a decreased level of elastin. This led to the question, does an alteration in collagen quantity or quality lead to hiatal hernia formation? The aim of this study was to examine the relationship of the biologic environment of the esophageal hiatus through the analysis of the collagen content of the gastrohepatic, gastrophrenic, and frontoesophageal ligament. Patients were prospectively enrolled in this study. The 2 study groups included patients with the preoperative diagnosis of type 1 hiatal hernia and type 3 paraesophageal hernia, patients with achalasia or morbid obesity without a paraesophageal hernia, undergoing laparoscopic esophageal myotomy or laparoscopic gastric bypass were included in the control group. Participants were consented preoperatively for tissue samples, and intraoperative specimens were collected of the 3 supporting ligaments. Here to the right you can see intraoperative sampling of the gastrohepatic ligament. Slides of the tissues were stained with serous red and fast green. This stain was selected for its ability to differentiate type 1 from type 3 collagen when viewed through a polarized lens. Type 1 collagen appears red and type 3 collagen appears green. A total of 10 high-resolution images were captured of each slide for a total of 100 images per ligament for each patient group. The images were analyzed using a software program that included an automated measurement designed to quantify the areas stained in red corresponding to type 1 collagen and the areas stained in green corresponding to type 3 collagen. The average for each ligament was calculated and recorded. The ratio of collagen 1 to 3 was calculated by dividing the collagen 1 quantity by type 3 quantity. Statistical significance was defined as a p-value of less than 0.05. An appropriate statistical analysis was performed. A total of 30 patients were included in the study. 10 patients were in the control group, 10 patients in the each hernia group as well. The mean age was 56.2 years, and 21 or 70% of the patients were female. Type 1 collagen dominated over type 3 collagen in all study groups in each of the 3 supporting ligaments. In regards to the gastrohepatic ligament, collagen 1 quantity was equal between the study groups. Here you see that collagen 3 quantity was greater in the control group and the type 3 paraesophageal hernia group compared to the hiatal hernia group. Both hernia groups contained a greater ratio than the control group for the gastrohepatic ligament. In regards to the gastrophrenic ligament, the type 3 paraesophageal hernia patients contained greater collagen 1 quantity than the control. Collagen 3 was higher in control than both hernia groups. And there was no difference in the ratio for the gastrophrenic ligament between the 3 study groups. In regards to the frontoesophageal ligament, again, type 3 paraesophageal hernia in control had a greater quantity of collagen 1 than the type 1 hiatal hernia group. And once more, the control patients had the greatest quantity of type 3 collagen. Type 3 paraesophageal hernia patients had the highest ratio, followed by type 1 hiatal hernia patients. So in conclusion, the hernia groups had a different but not necessarily weaker collagen content of the supporting ligaments. The hernia groups had an equal or greater collagen 1:3 ratio compared to control. Therefore, a collagen deficiency or a decrease in collagen ratio does not appear to be an etiology of paraesophageal hernia formation. Thank you. I look forward to your questions.